Hi, my name is Jamie Adams. For several years now, many of the C-section patients at Shawnee Mission Medical Center experience different types of skin traumas with the removal of their dressing. In an effort to decrease the skin trauma, the hospital required skin prep prior to placement of dressing. The number of skin tears decreased with this new practice, however, blisters and rashes continued. The question is,
if a surgeon used sutures or skin adhesive and an off-site dressing for an abdominal incision, would it produce fewer traumas for the surrounding skin as opposed to the use of staples and other dressings? The dressings we will focus on are Primapore, Tegaderm with pad, Metapore, and off-site. Blisters form due to the lack of give in a dressing and the edema that exists due to the surgery. This lack of movement causes the skin layers to rub and results in blister formation. When blistering occurs, it opens up a new route to introduce bacteria that can cause infection. Kosker and Associates looked at 3 different types of dressings, Primapore, Tegaderm, and off-site. They controlled possible biases by using the same post-operative unit, doctors, nursing staff, randomization of dressing selection, and same data collection. Their study compared the moisture vapor transmission rate of these dressings, which is important in addressing the correct amount of exudate needed for wound healing. Another study emphasized 5 characteristics of an ideal dressing. These are permeability, transparency, low adhesiveness, protection from bacteria but allowing moisture to escape, and ability to stay on during cleansing.
The authors strongly believe that an off-site dressing produces little or no blisters as opposed to Metapore dressings, and they reduce dressing-related morbidity.
The cost of off-site dressings are higher than other products. However, the fact that skin traumas frequently require additional health care, which increases cost, could make the cost of off-site less overall.
There are 3 main ways to surgically close an incision: staples, sutures, and surgical glue or skin adhesive. To assess best practice, we must evaluate the effectiveness and comparisons between these materials.
Staples are a quick and easy method used to close an incision. This speed decreases the chance of bacteria moving into the incision, and it causes fewer traumas to the tiny vessels in the subcutaneous layer of skin.
Gould cited Mangrum and Associates in her article on surgical site infections, stating that sutures that use more than one strand have an increased risk for developing secondary infections, whereas one-strand sutures and staples have the least risk for developing these infections. She also noted that the success of suture placement rests in proper suturing technique.
A systematic review noted that doctors had more experience with staples, therefore it took longer to apply the sutures, which increased the operating room time and subsequently the cost.
When the authors compared the outcomes of sutures and staples with post-op pain levels, use of analgesia, scar appearance, and the incidence of infection or dehiscence, they concluded that there was a lack of significant data that implied one technique was better than the other, even though some articles suggested that patients with sutures required less pain medications and expressed satisfaction with the appearance of their scar over those with staples. The authors of this study feel that a patient and her doctor need to talk about the skin closure options and choose the one for which they both agree.
Another systematic review studied a randomized control trial on 90 surgical patients. They all shared the same perioperative care and an off-site dressing, but one half of the patients received staples while the other half received skin adhesive.
This study found both the skin adhesive and the staples a good choice in skin closing devices, and it failed to find evidence that one performed better than the other one did.
Sutures and skin adhesive take longer to apply than staples and are more expensive. However, an additional doctor visit for staple removal was eliminated, which could impact the overall cost.
Off-site dressings produce fewer skin traumas because of their high moisture vapor transmission rate, transparency, low adhesiveness, protection from bacteria, and ability to stay on through bathing. More importantly, research shows off-site dressings produce little or no blisters as opposed to other dressings. Even though several research articles state sutures causes less pain, less consumption of pain medication, less chance of introducing bacteria if using one strand, and better patient satisfaction than those receiving staples, the research articles could not conclusively support that sutures, staples, or skin adhesive were better than the other. Thank you.